I am Dr. Utkarsh Deshmukh, consultant nephrologist and transplant physician. Friends, in our routine life, we see number of symptoms and signs. Sometimes they are not that much serious, but sometimes they have the particular gravity. Today we are going to discuss a very common topic, and that is nothing but the edema. Now that edema, simply what we say in our layman language is that the swelling. This edema can be present in a particular body part or it can be present all over the body. So what is the edema? When we have a swelling secondary to certain infection, certain pathological process or some inflammation, or it may be secondary to some treatment you are taking. So this edema is particularly differentiated in two heads. That is edema which is present all over the body or edema which is present in a certain part of the body. When it present all over the body, we call it as the anasarca, and when present it in over the particular part of the body, we call this as a regional edema. So today we are going to discuss about the pedal edema. That is one of the type of the regional edema. So what is pedal edema? So when we say pedal edema, definitely it is related with our feet, and when it is restricted to your feet, ankle and lower legs. So person sometimes have this type of edema, which is a bit common thing. Suppose a person who is very obese and sits for a very long time, then he may have the edema. That can be physiological. That we don't have to worry. But it's not like that a person who is having edema and is obese, so you should take it completely normal thing. So what are the different mechanisms where a person can have this pedal edema? First of all, the common thing is that the person can have the venous obstruction. So what are the veins? Veins are nothing but the small vessels in our body which carries the blood from our whole body toward the heart. So what happens? Sometimes there is some congestion or some blockage to that particular vein of the feet or the legs, and the person can have the edema. Second mechanism is the lymphedema. So there is one more drainage system in our body called as a lymphatic system, and that system sometimes get occluded or obstructed, maybe secondary to certain infection, or it may be secondary to some pathological obstruction, maybe some tumor or maybe some injury which occurred. So this is the thing which can have. And many days or many years back, we had a filaria type of lesion where the patient has this type of swelling, lymphedema, and that was very hard to treat. Now, third thing is that suppose certain local injury occurs, sometimes trauma, or sometimes a patient can have a certain infection there that can lead to the edema. Now, when we see this pedal edema, what we need to learn about is that do we have any underlying serious pathology or is it a normal thing? So commonly we have the three important things where the pedal edema is present: certain cardiac condition, certain kidney condition, and you may have some liver problem. So when there is a heart failure or impending heart failure, suppose a person's heart is about to fail, then the person can have the pedal edema at the end of the day. So we have to see in that way when we are having edema. Suppose a person is having edema throughout the day, then the etiology can be other. But cardiac patients do have this type of edema when they have in the evening time, right? Then certain, as I earlier mentioned, the kidney problem. It can be acute kidney problem or it can be chronic kidney problem. Or sometimes the person just lose protein in the urine. We call it as the proteinuria, and then the person can have the edema. Third thing is a liver problem, where the person is having liver cirrhosis or acute liver problem. Then they may have the lower limb swelling that we call as a pedal edema. Now coming to certain normal things, like as I earlier mentioned, the obesity, or suppose in pregnancy they can have this type of edema, or suppose a person who stands for or sits for a very long time without any movement, most of the time in the flights. When a person goes for international flights, they have to sit for around 10 hours, 12 hours without moving much. So they can have this type of edema. That is not to be worried. But even though if you have this repeatedly or that edema is persisting for a long time, then definitely you have to see your doctor. Now, certain medications, they can have this type of edema, and that edema may be secondary to the particular medicine. For example, amlodipine. For example, the calcium channel blockers, they can have this type of edema over the lower limbs. That is the pedal edema. Then certain infection, for example, the sting bite or some trauma, that is also responsible for this type of edema. So what we need to do? We have to see that the edema which is present over the lower limbs is persistent, prolonged, or it is taking more time to resolve. Then you have to see your doctor. Your doctor may check your urine. Your doctor may check your blood. You may advise you to your ECG or certain liver function, kidney function test. You have to do them so that what if you have certain problem that can be delineated very easily. I'm a kidney specialist. So what I see, certain times patients give the history that I don't had a problem in my past and now they are presented with a complete kidney failure. So when I dig it in the history and ask them, they say, yeah, around 8-9 months back, I had a swelling over my lower limb that persistent for around 15-20 days. I took some medication, but I didn't evaluate it or didn't go to a doctor and not taken the proper precautions. And then the problem was chronically going on inside their body and they have now the complete kidney failure. So don't take it seriously. Take care of you in that particular way that if the edema is persistent, go to a doctor and see what is the underlying pathology. And then you can treat it properly. Thank you.